A discogram is a stress evaluation of a disc. It involves an enhanced X-ray imaging of the spinal disc of the neck or back. A disc is a soft elastic cushion between your vertebral bones and your spine. When a disc herniation occurs, the tough outer boundary of a disc ruptures and the softer inner center is pushed outside, possibly compressing spinal nerves and/or the spinal cord. This may result in neck or back pain when referring discomfort and/or weakness in the arms or legs. A discogram is a stress evaluation of a disc designed to reproduce your pain. By nature of the test, it is designed to bring out the pain that may be generated at a certain disc level. It can also show if the disc has a complete or incomplete rupture. The test is typically performed before surgery to determine what type of level should be surgically treated and what type of surgery is most appropriate. During a discogram, dye is injected into the disc and an X-ray is taken to evaluate if the dye remains in the disc or if it leaks through a ruptured area of a herniated disc. Before the procedure, you'll be taken to the radiology department and an X-ray of the neck or back will be taken. You will then be taken to the GVI lab for the discogram procedure. You will be given a small dose of medication to help you relax. For a lumbar discogram, you'll be asked to lie on your stomach with a roll placed underneath your hips to straighten your spine. For a cervical discogram, you will be asked to lie on your back with a roll placed under your shoulders to extend your neck. A local anesthetic is applied to numb the area to be tested. Needles are placed along the right side of your back for a lumbar discogram and through your neck along the throat for a cervical discogram. During the procedure, a fluoroscope allows the doctor to see the needles as they are inserted into the discs. A fluoroscope is an X-ray technique that enables the doctor to see real-time images on a TV monitor. Dye is then injected into the discs and X-rays are taken. You will be asked to describe the specific location of your pain. Although you will experience discomfort, it is of utmost importance that you lie still throughout the procedure. Once all the appropriate levels are tested, the needles are removed and a Band-Aid is applied. After the discogram, you will be taken for a CT scan of your neck or back. You will then be taken to recovery room where you will be discharged home after 1 to 3 hours. Your procedure will be scheduled at Gates Vascular Institute. Your procedural arrival time is 6:30 a.m. Once your procedure is scheduled, you would need to complete blood work 10 days prior to the scheduled date. If we do not receive your blood work results 5 days prior to procedure, your procedure will be canceled. If you have any questions or concerns, do not hesitate to call our office at 716-852-1977. You must have someone drive you home after the procedure. If you have any allergies, please contact our office at 716-852-1977. If you have an allergy to contrast or iodine, we can prescribe medications prior to the procedure as a precaution. Do not eat solid food after midnight on the night before your procedure. You may drink clear liquids. If you take metformin or glucophage, do not take this medication on the morning of the procedure or 48 hours afterwards. Please notify your primary care physician of the need to stop this medication. If you take Coumadin, Xarelto, Eliquis, Pradaxa, Brilinta, Plavix, or aspirin, you will be instructed to hold this medication by our nurse for a specified number of days prior to the procedure. You must obtain clearance from your primary care physician that you may stop any of these medications. If you take Lovenox, do not administer this medication for 24 hours prior to your procedure. If you take anti-inflammatory medications such as ibuprofen, Motrin, Naproxen, Aleve, Celebrex, or Mobic, do not take this medication for 7 days prior to your procedure. Please leave your valuables at home. You may be asked to remove your jewelry, partials, and dentures. Before your procedure, you'll be dressed in a hospital gown and an IV line will be placed into one of your veins. This will be used to give you fluids and medications to relax you during the procedure. Most patients can be discharged home after 1 to 3 hours of observation following the procedure. Please understand that there may be unexpected delays such as hospital patient emergencies. As a result, the start of your procedure may be delayed. It is best that you plan on spending most of the day in the hospital. Test results will be sent to the referring physician. You should contact them to review these results. Do not take Compazine or other phenothiazines for 24 hours after the procedure. Do not drive or run machinery for at least 24 hours. Do not do any strenuous exercises, including swimming or lifting, for at least 24 hours. Do not take a hot bath for at least 72 hours. Do resume taking pain medications and anti-inflammatory medications when you get home. Relax and take it easy for 24 hours. Drink plenty of fluids and resume your regular diet. Keep puncture sites clean and dry. Change Band-Aid after a shower and remove it after 48 hours.